Primary care matters to me as a parent of a child with special needs because we are the voice to the ones that don't have a voice. We are trying to make their world a safer, healthier, more comfortable place because the world is not really set up to help people with disabilities. Primary care for me and for Kayla has completely changed my daughter's life. She is thriving. My name is Monifa, and I live currently right now in San Leandro, California. I have an 8-year-old daughter named London and a 6-year-old daughter named Kayla Thomas. Kayla was born early at 37 weeks. She was born with cerebral palsy. She was diagnosed when she was about 6 months old. Her primary doctor's name is Naomi Benazzi, and she's at the Children's Hospital in Claremont Clinic. It matters because, try not to get emotional, because Kayla's nonverbal. So she can't tell me what's wrong with her. I'm just a mother. I have no medical background, but for somebody that does have a medical background and that can see probably all of the challenges that she might currently face or that she might be facing, is it's like a weight has been lifted off of my shoulders, honestly. And so I'm just very thankful. Before I had her as my doctor, Kayla was diagnosed as having fussy baby syndrome. She actually didn't have that. She actually had cerebral palsy and some different other health issues. So for me to get a doctor that can recognize that and give her the right test and for her to be recommended to the right specialist, actually, I would say kind of saved her life. It made her life easier. The reason why I would recommend getting a primary doctor is that you have one source to go to. It's not 4, 5, 6 people, and the primary doctor should be able to coordinate with different people. If you need to see a specialist or if you need to do a follow up, if you just have one primary doctor, it just makes your life a whole lot easier. If there was no primary care, life would be hard for me and for Kayla. She wouldn't get the care that she would need, and it would make her life harder than it already is. The concerns that I have for the future of primary care is that maybe one parent and one child may not be able to experience what I have experienced, and they would have hope in their doctors. Some parents are feeling like they don't have hope because they don't have a primary care doctor, or they don't go to doctors, or the doctors they go to don't understand what they need or that they can help them. So my concern is that parents and patients will not have trust in the system anymore. One of the things that she did help me with was connecting me to different specialists. She also gave me information on disability for Kayla as far as like socials, applying for benefits for like Social Security that would help with financing. So I was blessed that I did receive that information. I did learn some things along the way, but I was blessed that I was getting such care since Kayla was such a young age that we were able to navigate through different specialists and different organizations that would help us out. They can think of things from a medical point of view or to think ahead of things that might be a challenge in the future or that she might be going through, but that I may not see as of right now or may not know. They would be offering us help and be thinking of how we can make Kayla have the best life as possible because she's nonverbal. Dr. Spinazzi asked me how I'm doing mentally, and she recommended self care for me to do. And she always encourages me and tells me that I'm doing a good job as being a mother. And she knows how hard of a task it is to raise a child with special needs. So she instilled in me that you're doing good with Kayla. Kayla's okay, but make sure that you take care of yourself. And I think that's what some parents need to hear because it will help. It does help.